I'm Dr. Diana Kerwin. I'm an internist and geriatrician. I've been working in the field of Alzheimer's disease diagnosis and management for 20 years. So my interpretation of memory care, well, what I go to with memory care, I go right to brain health. For me, that would be, for memory care, it's everything that can be done in order to preserve that particular patient or individual's cognitive function, which leads to global function. And so it's addressing whatever issue is occurring for that patient, whatever level, applying it to them at that time. So memory care could be preventative. It could be patients that are at risk for the development of Alzheimer's disease, either through family history or known genetic makeup, or a worried well patient of what information can be given to them for the prevention of any onset of cognitive decline or cognitive impairment and decline in the future. So that would be the initial memory care for that preclinical or prodromal patient. Some of that may entail biomarker identification. Sometimes it may not. Sometimes we can apply that type of brain health prevention to every individual, regardless of knowing their amyloid status. For memory care for patients that are starting to develop early cognitive impairment or cognitive decline, then it really addresses where they are with how that is impacting their daily life and being sure that resources are being brought to them to assist them with that stage and provide the highest level of functioning and independence for them. And that aspect, once you get into more of the symptomatic phases of memory care, really goes through all of the stages. And that's, I think, one of the biggest challenges for physicians, primary care physicians, and even specialists in memory care as patients do start to develop the cognitive impairment and functional decline is how do you basically evolve with the symptomatology that the patient is experiencing? How do you plan for the future so that you can help them avoid some bad or more difficult outcomes? And how do you really prepare them for what's going to occur as the disease progresses? What would be the treatment plan? What would be changed as if the patient does progress through that, their cognitive impairment and function?